10 ancient medical practices, surprisingly ahead of their time. Thousands of years ago, physicians were already developing treatments and surgical techniques that still have surprising connections to modern medicine. Egyptian wound treatment. Egyptian medical texts describe cleaning wounds and applying honey, which has antimicrobial properties. Some principles remain relevant to modern wound care. Indian surgery. The surgeon Sushruta described reconstructive surgery, wound treatment, and procedures including cataract surgery. His Sushruta Samhita became an important text in the history of Indian surgery. Fermentation-based treatments. Ancient healers used fermented substances in remedies and wound preparations. Fermentation can produce alcohol and organic acids that inhibit microbial growth. Roman battlefield surgery. Roman military doctors cleaned wounds, sutured injuries, and performed surgical procedures on wounded soldiers. Their organized battlefield medical care was remarkably advanced for its time. Greek fracture treatment. Hippocratic physicians developed systematic techniques for treating fractures and dislocations. Their emphasis on examination and observation influenced later clinical medicine. Chinese acupuncture. Acupuncture developed in ancient China as part of traditional medical practice. It remains used today, particularly for certain types of pain, although evidence for its effectiveness varies by condition. Inca cranial surgery. Inca surgeons performed trepanation, creating openings in the skull, often to treat head injuries. Many skulls show bone healing, proving that some patients survived the procedure. Mesopotamian medical records. Mesopotamian physicians recorded symptoms, diagnoses, and treatments on clay tablets. These records reveal some of the earliest systematic attempts to document disease. Cupping therapy. Cupping was practiced in ancient Egypt, China, and the Middle East, traditionally for pain and well-being. It remains used for some muscle pain, although evidence for broader benefits is limited. Heat therapy. Ancient Greeks, Romans, and East Asian cultures used hot baths, heated stones, and warm compresses to ease pain. Controlled heat remains part of modern physiotherapy. Ancient medicine was far from modern, but some of its practices were remarkably sophisticated for their time. Which one surprised you most?